I can speak for most people in ophthalmology that we have a very exciting job, a very meaningful job, and one that's very, very important for the society and for our patients. And that job is preserving vision and restoring vision. There are many different diseases of the eye. Many of them can threaten the vision. And as we're getting older, as our population is growing, as we're living longer, there are more and more eye conditions that cause visual impairments. Currently, we have a lot of good therapies for conditions like cataract and corneal issues. Where we don't have good therapies are for structures in the eye that don't have regenerative capacity, so things like the retina and the optic nerve. And that's sort of the holy grail for curing blindness, is to try to determine some types of regenerative therapies that can regenerate the optic nerve or regenerate the retina, or somehow replace their function with something that's similar to how it functions naturally. My area of interest is trying to determine if there are vision restoration therapies that we can help utilize to restore vision in people that have lost it and are blind. Another vision restoration approach is through an artificial retinal prosthetic device. We've been the first in the US to implant a photovoltaic wireless implant under the area of complete retinal degeneration in patients with end-stage macular degeneration. And basically that implant allowed patients who normally weren't able to perceive any light or have any light sensation to be able to capture light, process it, and then send signals along the visual pathways. These types of treatments, at least right now, are not silver bullets. So oftentimes we'll employ some of these experimental treatments, and it's not like we send the patient home and that's it, they start seeing better. It's one of those things where we have to continuously train them, and does require a lot of effort on the patients, for which we're incredibly grateful for. Without the patient's participation in these clinical trials, things cannot move forward and subsequent generations cannot benefit.